In today's video, we'll go over the major signs and symptoms of ectopic pregnancy. Ectopic pregnancy is a potentially fatal condition that occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tubes. But before we begin, like the video and subscribe to the channel to never miss an update. It is critical to understand the symptoms of ectopic pregnancy in order to seek immediate medical attention and avoid further complications. Where does an ectopic pregnancy occur? When a fertilized egg implants outside of your uterus, you have an ectopic pregnancy. The egg is designed to travel down your fallopian tubes and embeds itself in the uterine wall, where it can develop. In an ectopic pregnancy, the egg implants in one of the structures along the way. The most common location for this to occur is inside your fallopian tubes. Approximately 90% of ectopic pregnancies occur here. Ectopic pregnancies make up about 2% of all pregnancies. So, what are the warning signs and symptoms of an ectopic pregnancy? Early symptoms of an ectopic pregnancy can be very similar to those of a normal pregnancy. However, during an ectopic pregnancy, you may experience additional symptoms, such as ectopic pregnancy symptoms typically appear between the 4th and 12th weeks of pregnancy. Some women exhibit no symptoms at first. They may not realize they have an ectopic pregnancy until an early scan reveals the problem, or they may develop more serious symptoms later on. The main signs and symptoms: if you miss a period, have a positive pregnancy test, and show other signs of pregnancy, you may have an ectopic pregnancy. If you have a combination of any of these symptoms and suspect you are pregnant, see your doctor, even if you haven't had a positive pregnancy test. Vaginal bleeding. Vaginal bleeding differs from regular menstrual bleeding. It frequently starts and stops, and it can be watery or dark brown in color. Some women mistake this bleeding for menstruation and are unaware they are pregnant. Vaginal bleeding during pregnancy is relatively common and isn't always a sign of a serious problem. But if you experience it, you should seek medical attention. Tummy pain. You may experience tummy pain, usually on one side. It can appear abruptly or gradually, and it can be persistent or intermittent. Tummy pain can be caused by a variety of factors, including stomach bugs and trapped wind, and it does not always indicate an ectopic pregnancy. However, if you have it and suspect you are pregnant, you should seek medical attention. Shoulder tip pain. Shoulder tip pain is a strange pain that occurs where your shoulder ends and your arm begins. It's unclear why it happens, but it could be a sign of an ectopic pregnancy causing internal bleeding, so seek medical attention immediately if you notice it. You may feel discomfort and even pain when going to the toilet to pee or poo. You may also have diarrhea. Some changes in your normal bladder and bowel patterns are normal during pregnancy, and these symptoms can be caused by urinary tract infections and stomach bugs. However, if you are experiencing these symptoms and suspect you are pregnant, you should seek medical attention. Symptoms of a rupture. An ectopic pregnancy can grow large enough to split open the fallopian tube in rare cases. This is referred to as a rupture. Ruptures are extremely dangerous, and surgery to repair the fallopian tube should be performed as soon as possible. A rupture can be identified by a combination of the symptoms like sharp, sudden, and intense abdominal pain, experiencing dizziness, or a fainting feeling in the stomach. Ectopic pregnancy is most commonly caused by conditions that slow or block the movement of the egg down your fallopian tube. This is possible because you have scar tissue, adhesions or inflammation from previous pelvic surgery. Your fallopian tubes have been damaged, possibly as a result of a sexually transmitted infection. You were born with an irregularly shaped fallopian tube. You have a growth that is obstructing your fallopian tube. There are a number of risk factors that can increase your chances of having an ectopic pregnancy. You may be more likely to develop an ectopic pregnancy if you've had an ectopic pregnancy occurred previously, a history of pelvic inflammatory disease, an infection that can lead to the formation of scar tissue in your fallopian tubes, uterus, ovaries, and cervix, surgery on your fallopian tubes, including tubal ligation or other pelvic organs. If you discover you're pregnant and have an IUD, intrauterine device, in place, or if you have a history of tubal ligation or tying your tubes, contact your healthcare provider immediately. Ectopic pregnancy is more common in these circumstances. Your risk may also rise as you get older. People over the age of 35 are at a higher risk than people under the age of 35. Up to 50% of people who have an ectopic pregnancy do not have any of the risk factors listed above. Seek immediate medical attention. If you experience any of these severe signs and symptoms of an ectopic pregnancy, ectopic pregnancy can be fatal, so early detection and treatment are critical. Remember, never ignore any unusual symptoms during pregnancy and always consult your doctor if you have any concerns. Thank you for watching, and we hope to see you again in our next video.